When women have decided they are done having children, they need to understand their options for permanent birth control. Permanent birth control is the second most common form of birth control in the United States according to the Centers for Disease Control and Prevention. There are many benefits to permanent birth control, but most importantly, you won't have to worry about an unplanned pregnancy. Is permanent birth control a good option for me? Your readiness for permanent birth control will depend a lot on your life circumstances. Therefore, it is very important to really consider what has happened in your life at the time of your decision. I'm ready. What are my options? If you made the decision to pursue permanent birth control, it is important to learn about the various surgical and non-surgical procedures available to you or your partner. Though most women are familiar with tubal ligation, also known as getting your tubes tied, and vasectomy, only a small handful of women have heard of permanent birth control that does not involve surgery. It is time to become aware of your permanent birth control options. Permanent options for females work by closing a woman's fallopian tubes through blocking, tying, or cutting them so an egg cannot travel to the uterus. There are two primary forms of permanent birth control for females. Non-surgical permanent birth control is sometimes called fallopian tube occlusion. This procedure involves placing a small insert in each fallopian tube. A natural barrier forms around these inserts in about 3 months, blocking the tubes. No anesthesia is required, though local anesthesia may be used, depending on the procedure and the patient. Backup contraception is required until you have your 3-month follow-up appointment to ensure the inserts are in place and the fallopian tubes are blocked. Ensure is a method of hysteroscopic sterilization that was approved by the U.S. Food and Drug Administration in 2002. In this procedure, a thin telescopic instrument called a hysteroscope is inserted through the vagina and into the uterus and is used to insert a tiny device into the opening of each of the fallopian tubes. These devices block the tubes and prevent pregnancy. The other option is tubal ligation, which is often referred to as getting your tubes tied. In this procedure, the fallopian tubes are surgically closed by either burning or severing and/or blocking with a clip. It is performed under general anesthesia and can be done laparoscopically using a telescope-like device that is inserted through a small incision in the abdomen. With both forms of permanent birth control, the hormones that control a woman's menstruation and the sexuality will not change. Therefore, your menstrual cycle or your desire for sex will not be affected. These procedures will not bring on early menopause. Determining whether or not you're ready for permanent birth control is an important decision. Professional gynecological services can answer any questions you may have and help you figure out what is your best option.